what I really want to do is open up the window, a door, whatever we want, for a conversation over the next few weeks with you guys. You have lived full and rich lives on so many levels. You have a lot of experience in the domains in which, I mean, many of you would say, I know a lot about religion, I know a lot about health and well-being, et cetera, et cetera. So I honor that there's a profound repository of knowledge about both of those domains in the room. What I want to do is introduce you to some concerns that I have had through the years of a movement that I've been part of, to be frank. True confessions, I need to acknowledge that this intersection of religion and health and the research, et cetera, that has gone on with is really where I've sort of lived out my academic career, and so it's the story I've been have told and been part of. But in that context, I want to critique, to give you some sort of window into the critique that I've tried to give through the years, while also acknowledging a critique of myself and those other and some of my colleagues, while also hopefully then looking toward, as we wrap the time up over the next few weeks, an idea of, but what are some possibilities? What are some possibilities of how we might think about religion and health that would not be as problematic as some of what I want to particularly discuss with you today? So today I will be sort of giving you the frame on some of my critique, some of my concerns of what's been of how some of the distortions have occurred at this intersection of religion and health over the last couple of decades, and then we will pull back and go through start a little more from a historical perspective, at least in the American story, and walk through it together toward what the possibilities might be. I guess I should first, did everyone get a copy of the sort of the basic syllabus? Norma, there are a couple of, maybe if we could, oh gosh, okay, sorry. Here, I'll help hand them out. I'm sorry. As you get this, you will start to see, I'll go ahead and be describing some of what I'm hoping to do with you. This week will be this kind of the introduction and framing the conversation of the time that we have together. And I do want it to be a conversation. I will, I do have some, quote content I want to get through each week with you, but I also want to be flexible enough that if there's burning questions or there's things you want to get at, raise your hand. I'll evolve with you. We'll work on it together. This is clearly a conversation, a discussion to be had, not just a lecture to be given. So that's real important to me that you feel comfortable doing that. But the basic thrust I'll go through in the syllabus with you first, and then we'll get started with today's introduction. Next week we'll be talking about. Let me pull back and say these readings. I know that I've been hopefully schooled properly by Norma to know that readings are only suggested. I understand that, and I honor that completely. Okay, but the readings will be available. I think we'll be sending those out by email. Okay, you'll be getting email attachments of the readings, and I'm going to just quickly go through a little bit about them so you'll have a sense of them. And then, if you can, at least glean through them quickly. I think it will foster a little better context for our conversation and what I'll be talking about with you. But I understand that some may not have time, etc. And I honor that. For next week, we'll be looking at sort of what I call the American story in the broadest sense of framing this conversation about religion and health out of our own history in the American context. You'll see that Hollifield does this primarily within the Protestant religious tradition. And I need to acknowledge to you from the beginning, the way I'm addressing this is hopefully going to be of value to you, whatever tradition you might come from, or denial of tradition that you might have. My hope is that this will be interesting and have some value for you, wherever you fall within the spectrum of sort of religious faith and commitments. But I confess to you that I do come out of the Christian tradition. That's my sort of who I am. Then some of the language I will use at times may seem particularly framed within that tradition, but please feel free to help me translate and to help it sort of accommodate whatever tradition you might come from that might be different from that. So Holofield does come out of that tradition, but we'll give you a sense, I think, of the broad spectrum of sort of what was happening within Protestant pastoral theological practices within that era, and I will narrate around that with you. Then beyond therapy is when you get the email attachment on that, you're going to think, oh my God, it's huge. Well, the good part is it's in the public domain, so I basically we can send you the entire thing, but don't worry about it. Literally, just pages 1 through 25 are all that I'm really focusing on with that, and that I would like for you to look through if you get a chance. But this is basically the compilation from the President's Council on Bioethics during that period of time on looking at issues around biotechnology, and I want you to focus on that last pursuit of happiness. We're going to be talking about that more over the next few weeks. So how do we think about that? And I'm going to give you a window on the way I want to address that some this morning. Then we'll move on to implications for religion and health. And you'll start to see within this where one person we're going to be tapping into that some of you may know some of from past experiences. I think Norma said that some had read a book by him last year and done some work. But Wendell Berry. How many of you have ever heard of Wendell Berry before? Oh, good. Okay, great. All right. So you will see that we're going to use Wendell Berry as a lens at times, some of his writing as a lens to help us think about this question together. So he has a classic essay, Health is Membership, that you will receive, as well as actually a recent book. I'll experiment with you a little bit. I hope that's a reasonable prerogative but a recent book that a colleague of mine, Jeff Levin, and I have edited. That's Healing to All Their Flesh. It's published by Templeton Press, but particularly it's called Jewish and Christian Perspectives on Spirituality, Theology, and Health. With contributions, Jeff is from the Jewish tradition and helped put together about 6 essays out of the Jewish tradition. I contributed bringing together folks out of the Christian tradition into this text in which we've come together for this conversation around spirituality, theology, and health. And Warren Kinghorn's essay is out of that. And I do think Warren's essay is worth reading if you didn't read anything else the entire semester, or whatever 5 weeks we have. If you didn't read anything else, I think that little essay would be worth it. But we'll talk more about that. Then as we move on to thinking about communities as a context for practices of caring. And you'll see kind of where I'm headed. You're probably way ahead of me already, but we'll be building this together and looking toward practices of caring communities as context. 2 readings, one an article out of Perspectives in Biology and Medicine, the other God, Science, and Imagination by Wendell Berry. And then the last week, how many have heard of Hannah Coulter? How many have already read that? Great, wonderful. You already have it. Those who don't, that's the only thing that you won't receive by email as an attachment. But few books would I have the courage to say, but it's worth it. I wouldn't say that about many things. I would not give that advice. I don't have the courage. I mean, now Jim's more authoritative. Trust him when he says buy something. But I wouldn't say that about very many things. But I have no reservations recommending to you to buy Hannah Coulter. It's a beautiful little book, and it will be our sort of capstone conversation reading for our conversation that last week. Okay, that's our time together. I hope it makes some sense to you. Those of you who know something about Wendell Berry may already see part of where I'm headed. But so let's start to talk together about this for today, some of the pitfalls. Some of the pitfalls that I think are represented in the religion and health conversation as we look at it. Don't worry, there are not going to be a lot of these kind of slides, I promise. This is really just to sort of introduce you to some of the data-based parts of the conversation that have evolved over the last couple of decades, 3 decades. literally, we'll have 3 slides like this, but I just want you to have an awareness of it. Some of you may have seen some of this type of thing before, but I want you to have a sense of what's been out there in the scientific literature. It's amazing how the medical literature has just exploded over the last couple of decades with these kinds of studies. And some of them are pretty good. Some of them are horrible, really bad, and you should be suspicious of them, okay? And then some, we're still working to figure out what they really mean, okay? But one of the things that I would want to say to you from the beginning is, as you start to look at these, and these are all, I think, credible studies, or I wouldn't be showing them to you. They're credible about these associations. But I want you to realize, to hear that last word I said, associations. It's easy, and one of the critiques I've made of certain colleagues through the years have been the slippage into causation. It's been very tempting for a lot of people to say, oh, this proves this causes this. We just can't say that. These studies do not prove causation. They're associations. They show some clear sense of that there are associations between religion and health in certain ways that I find very interesting and that are important for our conversation, but they don't prove causation. And it's really important to keep in mind. We're going to be coming back to that to kind of deal with the issue that don't know mechanisms. We don't know these sorts of things. But let's look at these 3 together. First, this one that came out of Dartmouth, around 6-month mortality after open heart surgery. Then high religion, high social support, much lower mortality than low religion, low social support, much higher mortality than the high religion, high social support. Now, many complexities embedded within this that we could talk about ad nauseum with regards to the study design, etc. But on the broad scope of it, what I just want you to sort of get a sense of from this is interesting finding that those clusters of low religion, low social support versus high religion, high social support seem to make a very statistically significant difference between the mortality. Secondly, that was more of cardiac mortality issues around MIs, etc. This one's more around suicide rates. Phenomenal difference in suicide rate with regards to church attendance and race. White males, a much higher likelihood of suicide rate than black females with high church attendance. So black females with high church attendance, much lower suicide rate than white males with low church attendance. Now, the complexities of race interwoven with that, a lot of things to be sorted out with these sorts of studies, but still something at play. There's an association here between attendance in some way, and the one sort of little tidbit I would give you with regards to this sort of religion and health data is that of all the just literally thousands of studies that have been done at this point on trying to in some way get at that association from an epidemiological sort of population-based study, from the thousands of those, attendance in services is the most strongly associated and is the only consistently associated relationship from out of religion with health. Yes, ma'am. It would be like number. No. That's, and I claim to be. This is not a study I've dealt with in great detail myself. My hunch is that's going to be 4.9, probably days per month or something like that. Or I don't even day amount of time, but the relative difference is what's most significant there. Okay, so that's a very fair question, but that what I want you to see is the difference in those between white males, black females, and just the attendance factors. And again, I don't want you to be absorbed with this, because what I'm going to be going on to tell you is we need to be very concerned about any of these studies, okay? And then finally, this would probably be I find the most intriguing study on one level because of the numbers. 10,059 civil society. This is a large population base. So you got good numbers here, okay? And those who, and this is regarding heart disease and religious orthodoxy, okay? So, you may not be able to see the small print. These differences remain with regard to the mortality from heart disease, even when you control for blood pressure, diabetes, cholesterol, smoking, weight, baseline heart disease. Bottom line, even when you include all of those factors and control for those, the difference between non-believers and the most orthodox in whatever religious tradition people were in made a statistically significant difference with regard to their mortality from heart disease, with regard to their, you might say, intensity of religious involvement and activities. Now, again, an association, not causative. This does not prove causation at all, but an association. Interesting association, something that we want to take notice of, just like in that last one of the, suicide rates, etc., mortality from heart disease. There's clearly some association, but what does that really mean? What does that really mean? And those can be kind of seductive, right? When we start to see those kind of studies coming out like that, those can be kind of seductive, and we can start to think, oh my, this proves something. I've had colleagues that I won't name, but you may have seen them on various talk shows, etc., who would say, religion is good for your health, and then use these data to prove it. Is it that simple? Is it that? I don't think so. I don't think it's that simple. There's an interesting association that we really need to understand better, and I do think we need to be, and I want to be real clear on this, I think we need to be doing these types of studies and this kind of research. That's sort of my epidemiological background. That's my MPH type background. That's the preventive medicine side of me that Mr. Bishop was alluding to. I think we need to be doing, but we need to be doing it very carefully, and we need to be doing it well and with thoughtfulness about the issues that I'm trying to into over the next few weeks with you. And that means that the design and how we do these studies is very important from both the understanding and measurement of religion and what we're talking about when we talk about health. I want to invite you to really struggle with me about what are we talking about with religion and what are we talking about with health. What is health? What is health? And I think there might be different opinions on that even in this room. And I want to invite you to think about that with me, because it's too easy sometimes, I think, to just say, oh, we know what that is, right? We kind of just assume that health is, when in reality I'm not convinced that there is a consensus in our culture about what health is in so many ways. And I think so I want to invite you to that conversation with me to think about that. So, in this context of all of these kinds of studies, thousands of them being done over the last 20 to 30 years, with variety of quality and variability on interpretability along some of the lines that we were talking about, I want to then pull back and talk with you about then the sort of socio-cultural context in which we're doing all of this, which I would call the therapeutic culture. Okay. And keep in mind, when I, as I said, and I feel like I have to acknowledge this before Margaret, I'm a psychiatrist, okay? So I'm not anti-therapeutic, all right? I'm not anti-therapeutic, but I want to be careful about what we're doing. I want to be careful about what we're doing when we say therapeutic and what that entails in some ways. So I want to talk about three characteristics that I think about when I talk about a therapeutic culture. One is technological utopianism. This is a phrase that Jerry McKinney, who wrote a book a few years ago now called To Relieve the Human Condition. Isn't that interesting? To relieve the human condition. He's a professor at Notre Dame now. He used to be in Texas, but he's at Rice. But he's at Notre Dame now. And Jerry, this book, I think, he puts much time and energy into talking about this technological utopianism. But basically, some of what he's challenging is the perspective that, oh, if we just bring enough technology, if we just get one more tool, one more technique, we can eliminate suffering, right? Wrong. Good. I'm glad. Now, great response. You were listening. Now, I don't think so either. But Jerry's rightly, I think, challenging the illusions of contemporary medicine. And I think they're rampant everywhere. It's not just Vanderbilt, and it's not just Duke. It's not just, the illusions. At one time there was this, Duke used to have this ad, this billboard up on the main thoroughfare between Durham and Chapel Hill in North Carolina is 15501. You know, it's kind of it's the west end of Durham and Chapel Hill in a way. And so they had this huge billboard center. And again, that was my home. I'm not dissing on them too much, you know. And we have our own versions of this kind of thing at Vanderbilt. But they had this huge billboard for plastic surgery, the plastic surgery department. And this very stunning young woman or she probably wasn't real young, but she was young to me now. But she was the message to get is you can look like her. If you just, we have services that can make you look like her. And I'm like, I will never look like that. I could have all the plastic surgery in the world, and I will not look like that. I'm very convinced of it. But the seduction was, we have the technology. You give us you put the resources in, we put the technology in, and you can have this. And while that's somewhat lighthearted when we think about the issues with plastic surgery, think of what the implications of that as life gets more and more serious. But if if the message that we're giving is, oh, you can avoid we'll relieve your humanity. We'll relieve the humanness of your existence if we technology. If we just have more. That's a sell job, right? That's not going to happen. That's not going to happen. And one of the things we're going to talk about over our time together is the issue of when religion and spirituality get seduced into being part of that assumption of technological utopianism. What's happened? What's happening when we allow religion and spiritual, when we within communities of faith and practice start to allow and buy into the idea that religion and spirituality should be one more part of that technological utopianism and become just one more technique that can be used for that sort of presumptive assumption of we don't have to suffer. We can avoid our humanness through spirituality and religion in some ways. I'm not convinced that's quote, healthy spirituality and religion in certain ways. That kind of seduction, that's why, but it is seductive. Right? It is in certain ways. So we want to come back to that. But this phrase of technological utopianism is an important one in thinking about the therapeutic culture that we live in, and some of the critique that I want to make of that. Yes, sir. That they experience the pain. A little bit of a sidebar, but happy to. I'm convinced. I believe. I'm sorry. This gentleman was asking, of that people might have varying levels of religious commitment or intensity, and would they? And embedded within that is the question then of, do people experience pain at different levels, right? And I would want to propose that pain is a profoundly subjective for all of us, no matter what. It's like the variable of religion. We'll bring that in just a minute, okay? But first, pain is profoundly subjective. And I think there's no question that people can have what look like a similar experience. And this is not a judgment on either one, okay? That's really important that we keep that straight. It's not a judgment, but that their experience is profoundly different. What looks like a similar, talk about pain some more in just the degree to which religious commitments, involvement, etc., might mitigate or be a I think is relevant for the question. I think we have to be very careful, okay? And one of my critiques with the therapeutic culture notion would be to ever start saying, oh, and this kind of religion done in this way, in this fashion, will effectively mitigate the pain more than that one. That's when we're getting in troublesome territory. That's the temptation, though. Within this religion and health and the obsessions with technological utopianism, the tendency, the temptation that I've seen in the literature, et cetera, through the years is to want to find, well, what kind of religion, done in what way, standing on what foot, with what your head done, what will make it, what will mitigate the pain the most? And I think that gets problematic because then we're starting to make certain judgment calls that decontextualize it, and I think that's a whole problem that we're going to talk about some more. You with me a little? You understand? So, but pain is very subjective, I think. Always is. Always will be. Always will be, and that's okay. Yes, sir.
You showed it two slides, and I agree with it. But there was a religious attendance practice. The studies I've seen show that having claiming religious faith that's private and not involved has much less of an impact than being intended.
That's exactly right. That's exactly right.
So they're a little bit of an atheist, but not much.
No,
But if you go to church or attend something, that's a
absolutely. Church attendance at whatever tradition. Attendance at services is the most is the most strongly associated with health. That's not saying causative though. That goes back to doesn't prove that attendance causes that. It's just they're associated. That's the strongest finding in the literature, okay? That's absolutely right. But we don't understand that at all. We don't have and I'm wanting us to be very careful about assuming what that means. Yes, sir. Yes, ma'am.
But that doesn't address the issue of religiosity of the person attending. One would make the assumption that the person attending more often would be more religious. However, they may go because they like the music.
That's absolutely right. That's where you cannot make that. See, I mean, that gets back to you're nicely pointing out the issues around, and some of the language here would be intrinsic religiosity. One of the measures that's made sometimes in comparison to attendance is measures of intrinsic religiosity or religious practices, daily practices, what I would call an intensity of engagement, etc. We're not going to try to address all of that, of which ones, because the truth is that thus far, and I can say this real systematically to you, the truth is that in comprehensive compilation of all those studies, they're consistently inconsistent. Consistently inconsistent except for attendance. And I'm going to give you my theories before we're through with our 5 weeks together of what what might be relevant in that attendance. And as you start to look at communities, you can see where I'm headed by the syllabus in certain ways, but we're going to talk about it a lot more. Because I think it's important. What this gentleman was saying a minute ago, and I'm going to underline it a little bit more of, it's the literature that the consensus of the literature as I would see it. If you're looking at this sort of epidemiological literature we were looking at a few minutes ago, the consensus of that literature would be claims of belief really are not relevant to this story in certain ways. Does that mean, I want to be real careful here, does that mean that claims of belief are not important or irrelevant for one's life? No, I'm not saying that. I'm not saying that at all. I think with our varied traditions that may be represented, etc., what we profess to believe is very important to us within our own particular traditions. But what we're looking at, and specifically in our time together, is the relationship with health. What's the relationship between religion and how do we think about religion and health together? What's, again, another way of saying, what's the right way of thinking about religion and health in this relationship? What's most constructive? When I say right, what's most constructive? What seems the most useful to us That's what I'm wanting to get. And I think what we've been seduced into are some of the things that I'm going to continue to show you here in just a few minutes more. Jan, will you? Yes. Yes, sir.
Do you think that the CPA program, especially that technical
That the what programs?
the clinical pastoral education program?
Yes. Jan was asking, do I think that the CPE programs abet that?
Yes.
In some ways, I want to be careful about that. There's a lot of diversity within, what he's talking about is clinical pastoral education, CPE program, which I've been a part of for many, many years in so many ways, as far as a supervisor and helping to kind of consultant in that work. I think, let me kind of take it away from CP because I don't want to pick on them yet. I think because I don't want to say I think there are multiple parts of healthcare systems that have abetted that. Okay, they have done their part sometimes. Okay, just because they're part of the systems and are vulnerable to these distortions that I'm talking about. Okay. But I think we, in many roles within healthcare, and then what I want to say, we within faith traditions have abetted this problem. And again, what I want to remind us of, it's not because people went out and I want to be real clear on this with regard to my critiques of myself and colleagues, etc. It's not like people went out saying, oh, I want to distort religion and health. And I want to be malicious on this, and I'm really wanting to deceive and lead people down a wrong path. I'm not saying that at all. I'm saying that people meaning well, wanting to do good things, and with good intentions, all in all, not always. Some people are just wanting to get tenure, but all in all, people with relatively good intentions still got seduced. By this therapeutic culture. Because technological utopianism is not just within, remember, I'm talking about broad sort of ethical domains of American culture, Western culture in general in so many ways. And then I'm particularly bringing it into focus in religion and health. But I think it's a critique across the culture. We are all seduced. We're seduced across the spectrum by this technological utopia. We all, I think, on some levels, yearn for we think we can eliminate suffering. We know better, but we still want to do it. We still think we can do it. I mean, to be frank with you, I think one of the great testimonies, and he can correct me, I think Jim's work in like the wisdom literature, etc., speaks to that suffering has been with us through the ages and continues to be. That doesn't mean we go seeking it. That does not mean we don't need to, friends, do we? Do we need to seek suffering? I think it comes our way. Sometimes when I used to teach, particularly in divinity school settings, I would sometimes ask students, I would say, okay, everyone who's never disappointed, raise your hand. And if anyone did, it's kind of like, why? Yeah, it's just not true. I mean, we've all been disappointed. And we've all suffered levels. And we're going to talk about that a good bit more over the next 5 weeks together. Because I think it's an important point in this conversation of religion and health. And you may want to say, oh, he's going to talk about suffering. I want out of here. I don't want to, but don't abandon too quickly, okay? We want to talk about suffering in a way, hopefully, that is redemptive and that has possibilities within these intersections of religion and health. But then finally, of components of this therapeutic culture is heightened consumerist expectations. And I think the top two fuel that. We have set ourselves, in my opinion, American medicine, which it's where I live out professionally, etc., has set itself up with heightened consumerist expectations, for a letdown, for all sorts of problematic ethical missteps, by this heightened consumerist expectation, by making promises we cannot keep, nor should we keep. I am not convinced that medicine and healthcare is for the elimination of suffering and for what is implied by that of the changing of our very humanity in certain ways. I think we're called to care well and faithfully for those who suffer. And hopefully sometimes we'll mitigate suffering. Hopefully we'll have a real impact on it. I'm all for that. I want to reduce it but the presumption that we will eliminate it and the advertisement that we can in some way consumer expectations in a way that then set us all up. Okay? And then, so when I start to think about this, what I'm wanting, this therapeutic culture, then I want us to think about what then particularly problematic is then when religion and spirituality get co-opted into that. When we start to make religion and spirituality one more technique, one more thing in the black bag to be pulled out and used on people in some way, then what have we done? What have we particularly, besides just the problems that I think are inherent within the therapeutic culture, and please, don't misunderstand, I'm a believer in personalized medicine, okay? If you listen to the radio in Nashville, you know about personalized medicine, okay? Do not go telling Jeff Balzer that I am in any form or fashion. Again, I believe in the possibilities profoundly, and you'll actually see in the little epilogue essay that I do, I sort of give a shout out to the possibilities within that. I absolutely, but it's all in the nuances and the subtleties of, do we keep perspective? Can we engage these possibilities that are part of our scientific opportunities within medicine? Can we engage them while understanding and asking the right questions and critiquing this therapeutic culture? And this would be an example of that seduction. The science of happiness. Look at this. A smiley face in the middle of the sort of sign for atomic energy. What an interesting juxtaposition. The smiley face and then this notion of the science of happiness that's going to come out of the atomic nucleus some way. I think there's a subtle misstep there. And then and this is the cover of Time from a few years ago. But I mean, these kinds of popular portrayals of this possibility of the therapeutic culture can be very seductive. And how many of you have heard the phrase positive psychology? It's out there these days. It's being talked about a good bit. We'll discuss it more over our weeks together. And I'm not trying to say yay or nay. I mean, it's very, from my perspective, at least, to be honest with you, just as among friends, rarely do I want to say yay or nay. Usually it's, well, a little bit of this, a little bit of that. Okay? There's some good perspective here. There's something we need to think about a little more there. But I love this chapter that Barbara Ehrenreich has written in this. She's got an edge to her critiquing the notions of positive thinking. That book's a whole different agenda. But this one chapter, Positive Psychology, the Science of Happiness. This notion of that there is a science of happiness. Do we really want happiness to be contingent on science? I mean, do we think is that really where we're looking? Is that really where we're looking? How many know Viktor Frankl? Ever heard that that name? Yes. He's written much, but this is a classic of his. Suffering is intended to guard man from apathy, from psychic, man or woman, from psychic rigor mortis. As long as we suffer, we remain psychically alive. In fact, we mature in suffering, grow because of it. It makes us richer and stronger. Now, we may feel like, wait a minute, I didn't want to go, I'm not seeking suffering. We're not talking about seeking it. If you know Frankl's story of being in concentration camps in the Second World War, you know he speaks from authority. He's not speaking lightly about it. And I don't take it lightly when we talk to offer you the thought of that we mature in suffering. That's hard sometimes to hear. But if we're honest with ourselves, perhaps it's true. Perhaps there's something for us. And the notion of that if we could in some way eliminate suffering, what would we become? how would that, think with me about that, of what would we become and how would our very existence be, if all suffering were eliminated, what would we be? How would we grow? What would we become? I was talking with one of your colleagues here a few minutes ago before we started, and I share this with you not in excessive self-disclosure, but just it's part of the story. So I'm going to be on. You know, we're going to spend a few weeks together, so you need to know this about me, and this is just a truth in lending factor that I'd given these talks. I worked with these issues, talked about these things for 20 years or more. This intersection of religion and health is really where I've lived my life professionally as well in many personal ways. And I used to, with the Viktor Frankl slide, with this slide, I'm confessing to you, I've used it for a while, so that shows you. I did put this together for you, but the slide I have used for a while. But when I would use that for many years, I would say, and I acknowledge I know nothing. I don't really know much about suffering. And I would say that, you know. But 4 years ago, my wife of 28 years, woman I'd been with since we were 19 at Vanderbilt as undergrads. We grew up together. She died suddenly. Literally, no forewarning, etc. I suffered. It had been good. We had had 3 children, raised 3 children together. I suffered. Now, I'm not saying I suffered like Frankl in a concentration camp. I'm not trying, just like you were talking about pain earlier, sir. We never try to say, oh, my suffering's more than yours. There's not some scale of suffering. I want to be very careful about that. But I could honestly, with integrity, after that experience, for a year, I suffered, friends. I did. I'm not going to lie to you. That was hard for me. Still hard for me. I'm much better, okay? I'm much better. We're going to talk about gratitude, too, over the next few weeks in some ways, because I think it's relevant. And we're going to talk about the juxtaposition of sadness and gratitude, and that those are important notions in thinking about religion and health. And if you see the wedding ring on my finger, I recently was married again. For that I give thanks. But I'm still sad. I'm not going to lie to you. And the woman I'm married to knows I'm sad. And she understands that. I'll always be sad about that loss. But it also taught me, I grew to learn, I understand this slide so much more. Mature in suffering. Would I go seek it? Absolutely not. But have I matured in that? I believe. And one of the things I told my children within a year or two after Patricia died, it was actually the first year around Christmas time, around that time, things were still pretty fresh, but I told them, I said, this notion of, I would never want them to have this in their life in any form or fashion, but they were in their 20s. They were in their early 20s when, and all in school, all in college. And I said, I would never want this for you, but you will be wiser and more sensitive to the pain of those around you because you have lived through this. And I would have not sought it, but that is one thing I do believe. You will, for your young ages, you will be more sensitive. And I have seen it. They just they have an understanding that they didn't have. So suffering and its role is important for us in thinking about this. We'll come back to this. We'll come back to these issues. And forgive me for that, too much self-disclosure, but I think it helps you know where I'm coming from and where we're thinking on this together. One of our most difficult duties as human beings is to listen to the voices of those who suffer. That's why we're so afraid of it, friends. That's why we want to eliminate. We want to eliminate it because we don't want it ourselves, but we're also afraid of it. Arthur Frank is a sociologist, a Canadian sociologist, who was a cancer survivor, etc. but very thoughtful gentleman who, in this book, wrote this book, The Wounded Storyteller. But I think one of the reasons we are so seduced by the therapeutic culture is because there's that yearning to not suffer ourselves, but it's painful to listen sometimes. It's hard work to be present with suffering, right? And so we want to avoid it in so many ways. So this word, forgive me for the commodification. I know that sounds like, oh, wait a minute, what are you talking about? Commodification and presumptions of entitlement in spirituality, religion, and health. I want to challenge, hopefully what I've been talking about with the therapeutic culture, this notion of that we are in some ways commodifying both religion and health is something that I want us to think through carefully with this. That we're making both religion and health commodities of exchange. Okay? And I think that's a distortion of both of them. They're both important enough to me. They both are enough. They are domains of which I would want to challenge us that are so significant in our phrase, you're going to hear me, human flourishing, that to commodify them is a distortion of them. To make them objects of exchange and trading in certain ways. I think they are more important than that. And I think the presumption then that in some level I'm going to show you a rather long quote, and forgive me for that, but where Joel Schumann and I challenged this notion in a little book we did a few years ago called Heal Thyself, where we basically are challenging that notion of the contractual exchange. It's easy in the spirituality and health movement, as it's transpired, that I'm trying to introduce you to today. If we're not careful, if you think about the way that gets done so often, it's some notion, whatever tradition you come from, of, well, if I do this, I get something in exchange from God. It's captive to that notion. And if we drill down on whatever's being said about it, frequently it's some version of that. Of, well, if I do this kind of thing in some way, God owes me, or whatever notion of divinity one has, and so I think it's rampant within it, and I think it's a distortion. I think it's one phrase I'd use. It's a domestication of God, whatever tradition was. It's the notion of I've got God in my pocket, and God's got to, God owes me in some way because I've done X. So I'll get health, right? I won't die, right? Won't work. You've all heard it before, but I've showed you some data earlier and told you about the variabilities of the research, et cetera. I'm going to tell you one statistic that you can really bank on. 100%. We will die. We will all die. That's a data point. I'm happy. I don't have any equivocation of sharing with you and saying, bank on that one, okay? That's a truth. We will. And no matter how much money we throw at it or how much technology we throw at it, we will. And we will not, by using some sort of spirituality move on things, we will not avoid it. There's not a technique that can be employed from religion and spirituality that will help us avoid it. Nor should it. But the illusion, even in the back of our minds that we could, that's part of the seduction. That's part of the seduction that I'm talking about. Okay. Here's just another front of a news magazine. Is religion good medicine? That's out there. This is sort of that look that that just starts to get I confess, gets under my skin. And it starts to drive me nuts. And so, because I think it embodies this illusion that there's a technique. Now, nothing wrong with the devotional implication of this. Please don't get me wrong. Don't misunderstand me on that. But what I would give to see a religion and health headline in some way that showed a group of people caring for one another, and as an embodiment of an example in some way of this notion of religion and health. So, yes, sir.
That statement is from a newspaper, so
Yes.
is science moving forward? Now we are 2012.
Right.
Has science moved in that direction?
Has science moved in which direction?
In the direction that was before the previous slide.
Right.
Why science is starting to believe? So is science now
Beli-
believing more?
You can, I mean, I would, if I look at the literature these days, I mean, there's the books that have in the last 5 years that have come out, whether it's Dawkins, Hitchens, etc. I'm not sure science is believing anymore. You know, I'm not convinced that there's a real movement afoot on that. I think so I don't necessarily think that's changing per se. I think the conversation, and I hope it's getting more sophisticated and better. But I'm not convinced that necessarily it's starting to believe. You know, I think that's these are headlines. These are to sell magazines, as you well know. But again, please don't get me wrong. I think the conversation, science and religion, very important conversation. I'm committed to that conversation. I just want it to be done well. You with me? I just want it to be done well. All I'm asking is that we do it carefully and not in a way that's presuming this seduction into this therapeutic culture. So is religion and spirituality, should this intersection be thought of as producing some way a therapeutic technique that can be used as the, you know, tongue-in-cheek, but the religion clinic, you know, do we want a religion clinic at Vanderbilt? Do we want a spirituality clinic? I don't think so, personally. Does that mean that it's irrelevant? Not at all. Do I think that it's important to be considering faithfulness, religious commitments, spirituality within the domain of health? Absolutely. I think we need to be better documentation about people's traditions and what they come from and how they've been formed. But that's very different than the presumption that there's some technique that can be used as part of a domesticated understanding and a commodified vision of both God and healthcare that can some way be used in the religion clinic at Vanderbilt. I think that's very different than the notion of formation in health through living within communities of faith and practice. Yes, ma'am.
People seem more comfortable not speaking of religion, but speaking of techniques that some religions have used in order to enhance people's experience, like meditation,
Right.
like deep breathing, or Vanderbilt's very much into that.
Oh, absolutely. And now keep in mind, I don't think that some of those practices that are good, what I would want to say behavioral health in some ways. Okay? I think there are a lot of practices that come out of and have been related to a variety of religious traditions that can be employed as useful methods of what I would call kind of psychosocial and behavioral health methods. Absolutely. But that's different than some notion of,
And that's a proper field for medical.
oh, absolutely, I think so. Oh yes, no, yes, ma'am. I think but that's very different than some notion of we're going to use this as a sort of pull this out of the black bag as a religious or spiritual technique. You see what I'm saying? And in those, yes, sir.
I've heard contemplation from people in mindfulness, and much of it
Comes out of the Buddhist tradition. There's a lot there. There's no question. Well, and no, it's not Presbyterian. I think that's true. God's frozen chosen are not going to be. No, I'm kidding. Are not going to be doing some of those behavior. You're right. I mean, that would not be acceptable. But I do. One of the things that I want to name for us is that I really respect from some of the folks who come from the Buddhist tradition, and I don't know if you have an awareness of this, that some have been saying, have been raising the question of that they feel like it's a bit of a distortion of their faith tradition when some of these practices are taken out of the context of what they would understand as a faith tradition and just used sort of decontextualized from that. And I honor that. I respect that. And so I think that's one of the conversations we need to keep having about what this means and how we think about those kinds of practices. Yes, ma'am. It's a great question. And I do think some of some of these techniques an effort to demonstrate or exhibit a control over God or control over ourselves in some ways? Are they a matter of control? I do think it's very legitimate to raise the question of that some of these methods are absolutely helping to, let's take an area I know, but let's say panic and anxiety symptoms. Okay? Is there absolutely a benefit for a whole set of folks to learn how to control those thoughts and those symptoms, etc., and that some of these behavioral methods can be useful for that? Absolutely. Real easy. Now, when we're talking about control, it's always an interesting question of what we're trying to control. Are we controlling ourselves? That's a whole nother, and the degree to which we are, not to digress too far into this, but the degree to which we have become our own God sometimes, I think that's a question that we're going to be thinking about at times. And that's a factor too. But I think the notion of, in some way, are they helping people gain some control? Very, very legitimately, and that's not all bad. But the issue becomes what are we trying to control? Is that fair? Yes, sir, in the back.
What is your view on
Spiritual healing. I knew this. I'm really not trying to be catty here. When you say spiritual healers, big domain there. What can you specify a little more? Sort of what? Okay, then that's fair. That's fair enough. Then I'll just say that I think within many traditions, okay, let me put it this way. When someone says, I'm a healer, I worry about that. Okay? When they say, I'm a healer, I worry about that. I'll leave it at that. But the notion of, within the context of a tradition and community of spiritual faith and practices, that people will be healed in some way. All right? That they will be, let me address the word healing a little bit more, that they will in some way come to a redemptive hope of a capacity for human flourishing in ways. They're still going to die. Remember what I said earlier, 100%. All right? They're still going to die. But that they may, in some ways, come to a capacity for what I want to call more human. I believe people can be flourishing even in death. I think human flourishing, even in the context of death, can be very real for some people. Okay? That's possible within. That I don't doubt. And for that we give thanks when there is that type of healing in some way. Is that hedge enough to? But when somebody says I'm a healer, I'll question that one. So does God want us to be happy? This is out of that same. He doesn't look. He doesn't look too happy to you. But that's this pursuit of happiness. Back to the therapeutic culture with me, and I would propose the illusion of the science of happiness. That if we just have enough technology, if we just have enough and we into it, if we just again commodify it adequately and then control it and manage it, that we will be happy. I question that's a point. That's where I want us to ask together, is that what we're really talking about? Another way I would say this, is there a better question? Is there a better question than, does God want us to be happy? Is there a better question that might help us get at this conversation around religion and health and how to think about it and how to think about its place in our lives and how, because I think I wouldn't be here with you today if I didn't think it's an important issue. Okay, so I'm not, and I've shown you some data and this kind of thing that reflects that there are some real associations that are interesting to me. I think we have a lot of questions about what they mean, and there's been a lot of overreaching in the medical literature about what it means at times. But I think I think it's important that we be thinking about this relationship, and I think there's a lot there for us, both from healthcare side, from medicine side, as well as from the communities of faith and practice, from various faith communities. I think it's important on both sides, whatever the community's particularity of the communities might be, and whatever in healthcare. But is that the right question? I'm not convinced it's the question that most aptly gets at how we should think about this relationship of religion and health, both from a scientific and a theological perspective. I challenge that this is the best question from both a scientific and a theological perspective and a broader philosophical perspective. I want us to look at a verse out of Micah 6:8, out of the Hebrew Scriptures. He has told you, O mortal, what is good. And what does the Lord require of you but to do justice, to love kindness, and to walk humbly with your God? See, I wonder if it might be a better question to ask, how might communities of faith and spiritual practice support and foster human flourishing? Might that be a better question for us to ask at this intersection of to guide us in thinking about religion and health? It's an important issue. It's an important intersection. I really believe it is. I wouldn't have given my life, my work to it, and wouldn't be here with you today. But is there, and there may be a better way of framing the question that you can come up with, and I'm very open to that. But would this at least be closer? Yes, ma'am? I'd be very comfortable. Wholeness? I'd be very comfortable with that. Yes, ma'am. That's what I mean by that. I think there's a lot of nuances of language. That wholeness and human flourishing, absolutely. But I would want to avoid cure and, again, what I'd be asking you to do with me is sort out the seductive sort of illusions of the therapeutic culture and how it starts to distort faith commitments and healthcare, okay? I want you to sort that out I'd like to dissect that from it and find ways to ask this question that avoid those seductions and those temptations that are part of that. And that's what I want us to do together and think about together over these weeks that we have. And hopefully some of the things we're going to read together will help us keep thinking about it and asking the questions. Yes, sir. Possibly. Let me come back to that on some levels of that of a question I want you to struggle to think about with me. What do you think? And you can try to answer it a little bit right now, but what is human flourishing? What would it look like to you? When you think about human flourishing, and philosophically what I'm asking you, to what ends do you live? What is your good? And there can be a lot of diversity in that. To what ends are we living? Are you convinced that we live with, knowing that in the confines of our human existence, to what ends do we seek to live? What does human flourishing look like for us? Okay? What would it look like? And I ask you really to think about that for yourself, of what would it look like for me? How do I understand human flourishing? What do I think human flourishing would be like? What would it be? What would my experience be with human flourishing? if I really ask myself what that looks like. And how might that be different or similar to happiness? Yeah, how many of very well, I'm blanking on the name of the movie. Robert Duvall movie, 20 years ago. Tender Mercies. Oh, thank you. You've seen it. Okay. You remember it. Robert Duvall. I'm sorry. I kind of like Robert Duvall. I think he's a classic. And then he's got this scene where he says, I don't trust happiness. I don't trust. He's basically giving you the grossly paraphrased Cliff Notes of the movie, and you correct me if I'm stating this. But I mean, he's basically an alcoholic country music singer who's completely down on his luck, and he is redeemed by the love of another person who says, I will stay, I will love, I don't accept everything you do, but I will love you. And he finds a life, I think, of human flourishing, but he doesn't trust happiness. He's seen too much. He's seen too much. That doesn't mean that we don't seek it and that we hope for times of delight and joy. Very legitimate to hope for those times of delight and joy. I don't want to counter them at all. But I do want to challenge us with regard to the notion of the science of happiness and the pursuit of it in the context of a therapeutic culture using religion and spirituality as the technique by which to attain it. I think that's a distortion from both the health side of things and the religion side of things. And I think I think that leads us astray. I will quickly those of you who if you've already read Hannah Coulter, just to sort of give you guidepost or signpost of where we're headed in our few weeks together. But there's a wonderful paragraph, for me at least, of when she says, and so an old woman sitting by the fire, waiting for sleep, makes her reckoning, naming over the names of the dead and the living, which also are the names of her gratitude. What will be remembered, Andy Catlett, when we are gone? What will finally become of this lineage of people who have been members one of another? I don't know. And yet their names and their faces, what they did and said, are not gone, are not the past, but still are present to me, and I give thanks. I love the image, and if you read this book with me, but the image of Hannah Coulter as an older woman sitting by the fire, you'll know she's had significant losses in her life, but significant delights and joy as well. Lived a very embodied life, and that's important here in the notions I want to talk with you over the next few. A very embodied life, not an ethereal, spiritualized life, but a very, I would say spiritually, she doesn't use that language, but spiritually formed and substantive embodied life that knows the gratitude of the members of those she's been with through the years, and names them, sitting there naming them, and she gives thanks with gratitude. There's 24. She gives for them she gives thanks, and for those of you who are within the from the Christian tradition, I think in many ways she's speaking of the communion of the saints. She's speaking the past and the present. And then finally, this is just a great new book. This is a new book that's just come out in the last couple of months called God's Hotel, written by a Dr. Victoria Sweet, a woman in San Francisco. That it's not a religion and health type book, and it might seem more God's Hotel. It's not a quote theological or religious book. She's telling the story.
That's what the French used to call it. Hotel Dieu.
Yes, say that again.
The French used to call the hospital Hotel Dieu.
In essence, that the French would have called a hospital. The French would have called a hospital God's Hotel. And so she is a physician who went on to do a PhD in history, and worked in a hospital in San Francisco that was really, you might say, the in-road hospital. It was the hospital when all else had failed, when people, and it was a hospital where people, length of stay was not really relevant. You went there and you might go there to die. The amazing part was how many people started to live again after they went there. But I just quickly read to, and I commend it as it's a great read. It's full of stories about caring for those who are the most vulnerable and frail among us, which I think has some intersection with thinking about religion and health. But she's talking about a gentleman who, and I don't want to spend too much time on it because I know we've got to, but she's talking about a gentleman who has been a heavy drinker, an excessive drinker, has come in, barely been brought back to life with technological medicine in which she is quite competent and is well versed and consistently gives people good care. But she's also learning about what it means to have healing, okay? To have what it means to care for people in a way that they are healed. That doesn't mean they're cured, but that they are healed in the fullness of that wholeness that was alluded to earlier. And I would say, yes, even human flourishing. And she's talking about after that there is this gentleman who has literally nearly died before has come back to the hospital, and she's gotten to see, and he's doing quite well. He's flourishing again, okay? And I'm not going to capture the whole thing for you here, and I apologize for that. But a person who, any of you who've been part of 12-step groups or have some sense of AA, whatever, and I'm not here to advertise yay or nay on that or what, but I want to bear witness to the notion of a community of people who say we care about one another. And this person, this is about the sponsor, okay? And I just want you to hear, he's talking, the gentleman who basically came back from the edges of death, and he's come to the memorial service for his sponsor. I hadn't planned to, Dr. Sweet was asked if she was going to the memorial service. I hadn't planned to, but Mr. Ratman, this is the gentleman who nearly died, had captivated me with his vitality, his evident wellness. He was no longer not ill, but well. In fact, his wellness exuded through his skin, his rocking to and fro from his feet, through his voice, hair, and eyes. And while medicine had done a good job of saving Mr. Ratman from death, her medicine, her practice of medicine, the techniques she had used, had saved him from death, it was something else that had made him well. And that something seemed to have been Don Taylor. So I decided to go to the memorial service. A relationship, an investment of a, and he had told earlier how when this man first started coming to see him, he yelled at him, threw him out of the room, didn't want to see him anymore. But a redemptive relationship ultimately transformed him. And Dr. Sweet is, I think, very astute to be saying, my practice of medicine helped bring him back. My practice of medicine had done a good job of saving Mr. Ratman from death. It was something else that had made him well in human flourishing. And I want us to think about the intersections of religion and health together, not captive to that therapeutic culture and all the distortions that it can embody for both religion and health, as we think about the possibilities that are there when we really consider that intersection for making folks well for human flourishing, and how that's formed over time in the context of a variety of communities of practice. Thank you for your attention.